Good morning, sir.
Good morning, madam. Good morning, madam. Good morning. Thank you very much for your investing, or you can say on this particular Sunday. And as we discussed, we'll see 2 days in a week so that it will be convenient for everyone, because it is not a punishment here. It is a adjustment, and we all people where they agree, we will do that.
Yes,
Okay.
sir. Yes, sir. Thank you.
Yes. So today's topic, you must have all understood, today is a biochemistry. Biochemic what is the biochemic? Because earlier times, a biochemic was taught separately like a batch flower MD. It was taught like a batch flower MD, and it was a separate, what you call modality, treatment modality only. It is not, but what happened is, because of lack of, or you can say similarity of the pharmacy, this particular biochemistry has been hijacked by the homeopathy. Now you see, on all biochemic medicine bottle, they are writing it as a homeopathic medicine, and below that they say this is the biochemistry, and this is the remedy. So anyway, let anybody hijack their own system, but we are concerned with our vibronics. So, and advantage of the biochemistry is, and one more beauty of this is, I am repeating it. It is, biochemistry is a complete system, complete treatment system. You can start your journey with only biochemistry, and you can do many things, everything you can call. But only thing is, you need to adjust the potencies. So that's what, if you start your journey with a biochemistry, it is not at all a surprise, or you can say your treatment protocol will be excellent. So now, so I think so you have all downloaded the three books. First two are they are easy to follow. So next one, that is a biochemistry, just like a repertory. Repertory is a thing we can go minutely within the symptoms, what biochemical remedies are suggested, and few some restrictions, because some remedies are they can't be mixed. Otherwise, in biochemistry, the system itself allows you to mix different biochemic salt and give as a remedy. It is allowed. But in homeopathic classical system, it was not allowed. It was only simple. There is a lot of controversy on that. We will not take that this one into very deep. So homeopathy, because the Hahnemann was a researcher, कुछ ना कुछ करता रहता होता वो, मेरा जैसा. He is not, एक कर दिया तो और थोड़ा कुछ करेंगे, will little bit of improvement, like that. He was creating, means how medicine works, how homeopathy works, how pharmacy is, how pharmacy works, or I can say pharmacy of the homeopathy, how to dilute, how to dynamize, like that. It is well all written in the book called Organon. I request all serious seeker, I assume everybody is a serious seeker with me now. You must read the Kent's philosophy. It is available, I think, your Telegram channel, and they have many homeopathic books. You must read the Homeopathic Philosophy by J.T. Kent. So in that one, very beautifully, just like a story, they keep telling. He keep telling about the remedy, how to make the remedy, how to make the insoluble remedy. We are only talked about the soluble in water, but there are some remedies or which are insoluble in water. Then how you are potentizing, how you are diluting it, you know? These are all there in that organon. So he made the up to fifth organon. He wrote the organon repeatedly. He amended, or you can say added 5 times. And even at the lastly, he made the sixth time also he amended. The means, like, we release our version 1, version 2 and add something and give this one like that. Hahnemann also up to fifth one, he gave that to everybody, like mantra 7. So upgrading, giving. But what happened? But he didn't have a very good domestic life, that Hahnemann. So let us not talk about him, because we can only think that we named our clinic, a homeopathic clinic, in the name of Hahnemannian Homeo Center. Why? Because of his dedication to his own field. इतना serious था वो, he lost everything in his life. And now you see, homeopathy is the second largest practiced in the world as per the WHO. Though it is not recognized by the mainstream science. Mainstream science says after the 13th, 12th C, not a single molecule is there in that water. So still, it is the second highest practiced in today world. Okay. Just to give you some background, the homeopathy was invented in 1796. 1796, homeopathy was invented by just the first, what we already discussed, about homeopathy. The Hahnemann took that chloroquine, or you can say that juice, to test whether that a bitter syrup causes any malarial symptoms. And it was confirmed. And by that only, we have the same formula we apply to the coffee and the onion. So we can say onion creates a cold-like symptoms. So it is a remedy for cold. Coffee makes you awake, except our Amy madam, she feels sleepy. Okay, so rest all people are 90, 100 people, if you are giving the coffee, it will make you alert. So what happens sometimes when you want sleep, but you don't get sleep? Why? You are so alert, you're not going into sleeping mode. That time what is required? That time coffee is required in very diluted form. Very diluted. I just told you last time, only to make a 6x potency equivalent. But you can make it 30 potency, like take a 30 glasses. 30 glasses, take 1 spoon, put into next, stir it well. Again, take 1 spoon from the second one and put in a third one and stir it well. And again from third one, take 1 more spoon and stir it, put in the fourth one. Stir it well, like that. If you make it 30 times, and the last one is very, very powerful according to the homeopathy. That's what I was telling you. I was very much, passionate to start homeopathic pharmacy, because more you add the water, more powerful it is. ऐसा कोई थेरेपी है? नहीं है. ऐसा कोई सिस्टम है? नहीं है. For that reason, see, and सच डाइल्यूट अगर आपको डेली आपका बेंगलुरु में जब आया तो दे विल आस्क काफी हुआ, काफी किया, काफी काफी हो गया मीन्स एवरी डे एवरीबॉडी टेक कॉफी, very large quantity, at least 1 cup of coffee will contain 1 spoon of coffee powder. आप समझो, with 1 spoon of coffee powder, how many megaliters or you can say quintals of the 30C potency can be made? You can't imagine. I will calculate with the patience and I will tell you that with 1 spoon, maybe like, oceans of water required to dilute it to 30C potency. If we feel it is really a, exaggeration. No, it is like that. We will just imagine. Okay, so you are taking this and how much dilute it is. It is dilute. Mathematically, how we can say, if you say 30 potency, 30 potency will have 1 by 10 raised to 60th part of coffee. No, only scientists, or you can say only logical people, or only or economist, or you can say those are done commerce, they can think about this. 1 drop of coffee in 10 raised to 60 drop of water every time, just not adding that, adding and shaking and adding and shaking like that. So such a low that for that reason homeopathy doesn't have any side effect. Similar way, Vibronics, we are using only thought of coffee. Okay, or even thought of onion to cure, or can say we for a healing in the Vibronics. So it is. And there are so many books I learned, I read about this mind and the other thing. Even thought, see, any matter, you just see, take anything around me. You see, you will find many, like a door, you can say curtain, and even bell, everything around me, they are born twice. First thing, it is first took birth in somebody's imagination, intention. Someone intended to do like this. Then he designed it and he selected the material and then he made it. So what is the basic formula for everything is the intention. That is called as a, information. Information, we make so many, after when, how it was, there is a two different information. One information is, that information is a inborn information. Inborn information means, so morphic field also you can call. Morphic field of everything means what is designed, what it is designed for, what every particular medicine is born with its own, quality. That quality is called as morphic field or information field. So that information field works and liberates, as information field will never, even when you divide it into many multiples of dilution, still that information doesn't fade away. Okay, so that is the beauty, and that is we are a very scientific, so much scientific that today's science says we are all fools. Homeopathy. I'm not talking about, even we are big fools. So what we are thinking about that, because we are only putting our intention, we know, because intention heals and we have seen miracles. And we can say every time we make a miracles, don't know. But yes, once, see, how is science can predict this will happen because of our past experience. We see that our past experience like that. So with that, we see that future we will be able to do it. Okay. So now next, now let us take one of the book which I gave you. Okay, which one we'll take? We'll take the one which was shared by our Sri Ramji, Jai Sri Ramji. That's very, because it is very cheap. It is only 80 paisa. Okay. Special offer, 80 paisa and 15 paisa off. Okay. So we will take that. Mataji, attend class if you are free. The same link. I'll send you once again. It's a very interesting thing, very interesting. Because I enjoy telling these things. Oh, can anyone share this into Paramnath Brahma? Can anyone please share this today's class things in Paramnath Brahma? I am unable to do it here. Good, sir. Good. Thank you. Mataji, I shared in the Paramnath Brahma group. ठीक है. Yes. Who invented this technology? Who invented the biochemistry? Biochemistry was invented by स्विट्जरलैंड, विल्हेम स्विट्जरलैंड ऑफ जर्मनी, है ना। उस समय हम क्या कर रहे थे? वी आर बिहाइंड दी आयुर्वेदा, हाँ। सो गुड गुड, नो प्रॉब्लम। We will sort out some of the Ayurvedic remedies from our book and try to use them.
అమ్మా జల్దీ, కొంచెం టైం లేదు, నీది అయిపోతుంది. ఎంత స్లో.
Mute, madam, Mataji. Okay, this is a very interesting that Dr. Sujalar, what he did is, he thought that what are the basic structure? What is our body is made up of basic structure? What is the basic structure of our body? How we should come to know? How we should come to know? What he did the chemical analysis of the ash of the body. एक जल जाता है ना, one dead body, when it is burnt, he examined the ash of the dead body. बोलता है कि anything in this any health problem, or I can say health, is made up of these elements, these basic elements, and deficiency or excess of one or more. He is not talking about one. He is talking about one or more, that substance causes the disease. And if those are supplemented, and that time a disease cures. This is the principle of biochemistry. Let us see what is a biochemistry. We came here. Okay. The word biochemistry derived by Greek word. The bio is the life and chemistry of the life. And who is that? Dr. W.H. Switzerland, just over a century ago. What century ago means this book was published in very long back. Having said because, okay. So anyway, we have to search where that is there. So what it is, over a year, Switzerland proved that his satisfaction that certain minerals called tissue salt are vitally important to the health function and human body. He reasoned sensibly for that time that the vast majority of inorganic salt of our body were in the bone. So what he could measure. Anyway, मैं जो बोला था वही सत्य है, सत्य के सिवा कुछ नहीं. Means he analyzed this ash body ash of the body after burning. He found out what are the major salts. So, and that is the reason for the disease and the health. These are also called as a tissue salt. And it's very easy to practice. Because no confusion. There are only 12 salts. Only 12 remedy. So there is no confusion. And easy and effective. If everything is, everything we can make through this biochemistry, why we are going, you question may come, no? अरे सब कुछ इसीलिए इधर ही हो रहा है. Why we are thinking about other system? होम्योपैथी किस लिए चाहिए और वाइब्रोनिक किस लिए चाहिए, और यू कैन से वाइब्रोनिक मीन्स वी आर प्रैक्टिसिंग ऑल दिस थ्रू वाइब्रोनिक्स ओनली, बट अदर सिस्टम व्हाई दिस मच, इतना दिमाग खराब क्यों करना, ये बिल्कुल सत्य है। बिकॉज ऑफ आवर एंजाइटी टू नो मच मोर थिंग, क्योंकि हम लोग ऐसा है ना कि हमारे पास जो है व्हाट वी आर हैविंग उसको छोड़ करके दूसरा ढूंढते रहते, इट इज अवर कॉमन ह्यूमन टेंडेंसी। इससे भी बढ़िया कुछ है वो मिल सकता है क्या, इससे भी कुछ अच्छा मिल सकता है क्या, लाइक दैट ओनली। Our card machine, a small card machine, the Krishna Astra was sufficient for make everything. We still search for something new, and Krishna Astra, I named it, that instrument, just given for Uttarakhand, around 40 plus machines have sent there. We named it as a Krishna Astra, and Mataji is a leading and holder of the Sri Krishna Astra. Anyway, we have seen there are total 12 tissue salt obtained in the ash of the dead body. Calcularia fluor, calcium fluoride, calcium phosphate, calcium sulfate, iron phosphate, ferrum phos, potassium chloride, calimur, potassium phosphate, caliphos, potassium sulfate, magnesia phosphorica, sodium chloride, netramure, sodium phosphate, and sodium sulfate, and the silicon dioxide. These are the main ingredient they found in the ash. And now how this is to be feedback, how to give this back to the health, how we can bring back to health from this. And this they are noted that what proportion it is there in our body. If these are all ingredient, at what proportion are there in our body, if you supply at the same proportion, same dilution, they found that it absorbs very easily into the blood, and you can get the changes, you can just get the cure. Okay, so remember, calcium fluoride, only calcareous phos and silicea are given in the higher dilution. Whose instruction I am following? There is another great person whose book I already shared. First time that book was published in 1952. Before all of us we born. 1952. That is the simplest. The name is simplest remedy for all the disease. And every time, every session, I say, for getting the information, अरे भाई कि कौन सा बायोकेमिक मिक्सचर से डाल के बनाते हो? This biochemic powder is made up of what all the mixture? इसको सीखने के लिए I worked with some person, and उसका जो फार्मेसी में उसका डॉक्टर के साथ 6 months I have swept his clinic. क्योंकि गुरु लोग पहले ऐसे ही होते थे, आजकल के स्टाइल में आया ऐसा नहीं. So it was in 1993 I got this book. So that was a doctor called P.D. Gupta in Pathankot. I worked with him and I used to sweep his clinic. क्योंकि आजकल वही होता, उस्ताद को खुश करने के लिए हम कुछ करना पड़ता है. We washed the bottle clean because it was on the main road. Then after that, I asked slowly with hesitating he asked his son, please can you tell me from where these mixtures are made? Such a wonderful result, You can't imagine such a wonderful result. You can make your own protocol of the treatment, like how you make it. One bottle you make a biochemistry, one make a bio-vibronics, one make a like that. gemstone, or I just yesterday I was telling about the acupuncture meridian. You may give 2-3 bottles. Like what we studied recently, that cell having the same function will become a tissue, different function with one goal, different tissues making one goal. It becomes an organ. Like that, we create like acupuncture, biochemistry, and gem therapy, or all will work at one direction. You can do like that. You can create your own protocol, your own way, and share with me. Okay, don't so that still why medical line is called as a practitioner. Medical practitioner. They keep on practicing till their death. They never become perfect. Or you can say, health is such a thing, we can't challenge it. अरे कौन सा भी लेके आ जाओ मैं ठीक कर देता हूं, नहीं भाई, वो अगर कोई बोलता है तो वो मूर्ख है. For example, big people, big doctors, when we approach, very nice, Prabhakar, you are doing all Vibronics, and I'm very happy to hear you. But do you have any remedy for diabetes and cancer? They will knowingly ask you, ये क्या बोलता है? Well, no, we say, no, sir. We have helped many cancer patient or many people, but we never no able to cure the cancer. Or you can say we are able to get some result or cure, but we can't promise the same thing that we will do in future. So we can definitely try like that. Scientifically, they want to fix you, so that be very careful when you're talking with the scientific people. Scientific people means so-called scientific people. Okay. So, Jai Shri Ramji, we are using your book.
Sure, sir.
Your book only, what you have shared. It's a fantastic one. And it is only for 85 paisa. For 80
Yes.
paisa, isliye we are using this. Cheap
Yes,
and
sir.
So names and brackets are the short Latin equivalent names. So because in our all book and repertory, we get these numbers only, these names only. Potassium is called Kali, and sodium is called Natrum, like that. It is. And I request you, a combination, a ferrum phos, coliphos, anyway, the tissue salt contained these many combinations. We will come to this later, because a combination A, these combination therapies are named alphabetically after combination A and S, have different therapeutic use. Anyway, we will not follow this, because as I already shared, you have the liberty to choose any of the book, but my favorite book is the other one. We will go into that. And for important one, yes, we told, I already was telling that at the same dilution we are giving into the body. At what dilution it is existing in our body, so that easy absorption. Yes. Calcarea for us, it is a rule after the age of 40. It is required to give in 12x potency. And one more thing is, all biochemic salts are diluted, or you can say dynamized, only in decimal potency, x potency, x. Okay. So the Sigiller made this remedies using homeopathic principle of titration. They call with a 1:9 part of sugar of milk. Sugar of milk. Why sugar of milk? A sugar of milk is the substance made from the goat milk. And what is the beauty of that? like alcohol. Alcohol has a one must beauty. कुछ भी उसके साथ ऐड करो, अपना प्रॉपर्टी के साथ वो उसका प्रॉपर्टी बदलता नहीं है. That doesn't alter the property of whatever substance you put. If you put a coffee powder into the alcohol, and it will work separately, it will not make something else. कुछ और नहीं बनाएगा. So that is the beauty of alcohol and this sugar of milk. And it is alcohol, and the specially sugar of milk is neither acidic nor base. It is a neutral thing generally. Ideal things is a neutral thing. So 1:9 portion when you add, and that mix with the processing, the what you call successive dilution and grinding, we bring it to 6x, 3x potencies. Now I will use another book for explaining about the, in shortcut, this you should mug up. What is I'll see whether it is there in this book itself. Yes, what this tissue do in our body. Let us see if it is there. I will tell of my own, and we will add other something else from the books also. Okay. What is that? Calcarea phos is generally like a general tonic. Calcium and phosphate. Phosphoricum. Phosphorus. Calcium phos. Okay. So calcarea phos. Calcarea phos is just like a general tonic. Lack of calcarea phos will make you anemic and will make you weak. For that reason, calcarea phos is used. And let me check so that you can refer it later. Because if I tell you, unless until you listen my this back, you will not understand. So let us see whether it is there or not. Okay, now I will take another book, like a Darbari. I was telling you, na, 6 महीना एक इसके अंदर, उसके बाद डोंट थिंक दैट उसके बाद मैंने जादू जादू माना छोड़ दिया, नहीं. But after doing that only, I got this book. This book, very valuable for me. It is like just like a diamond. But आपको पता होना चाहिए कि हाँ, आपको डायमंड बहुत आसानी से मिल रहा है. So आपको मैं बोलता हूं कि दिस बुक शुड बी वैल्यूड नंबर 1. आपका बायोकेमिस्ट बुक के अंदर ये सबसे टॉप प्रायोरिटी में आपका बुक का लिस्ट में ये होना चाहिए. Because after knowing that this particular is a book which they are using for making the biochemic powder, mixtures of the biochemic powder. And there is in this book, there is let us see, there is a topic on that they have written where all this book is available. I don't know, because this is a very latest edition. They have kept it or removed it, we don't know. So there was a address of Jalandhar, Pathankot to Jalandhar. For buying this book, I came to know, then I called him. That time there was no mobile. I called him through some PCO. Then he said, yes, it is available. Then I went by bus, and I spent around I spent around 200 rupees for purchasing this 15 rupees book. This was costing 15 rupees only during that time in 1993. Okay. Anyway, please go through this very deeply. I think so. I was searching for Jalandhar address just to show you, impress you. but no problem. And there are wonderful, topic of this book. Even it shows what are the disease mean. Means it is basically, this book was written for the lay practitioner. It was not it was not for the qualified, you can say high end people. It was for everyone, just like a lay practitioner. Means कोई भी आप चाहता है कि मैं उसको, because that time in 1952 that homeopathy was not recognized. Anybody could practice just like what we are doing now. Like ना, कोई भी संस्था है, कोई भी homeopathic association, they will register, they will take a membership and they start practicing. It was valid before getting the recognition from the government. And the same thing is running till today in UK. UK, there is no any council in the government. Like, we have Ayush department, and Ayush H stand for homeopathy. Like that in UK, there is no any board. It is still managed by the association. So you can imagine. So what we will see, what all thing is there, homeopathy made easy, materia medica of this some important medicine. Yes, this is what I wanted. It is number 60. Let us see where is the 60. We'll go 60. I wanted to, and ये आपका पक्का मगप होना चाहिए भाई. These are the different nomenclature of the disease. ये क्या होता है, you should know ना. क्या में किसके लिए क्या मेडिसिन देना है, ये देना है. यस, मेटेरिया मेडिका, ये मेटेरिया मेडिका ऑफ होम्योपैथी भी ऐड किया उन्होंने. सो यू कैन रीड इट, इट्स गुड फॉर यू. एंड दे हैव सजेस्टेड सम ऑफ द व्हाई दे हैव एडेड दिस. Along with some group, they have suggested you take this also. So for that reason, they are telling this. Okay?
Hello, sir.
Yes, ma'am.
Sorry to interrupt you, sir.
Yeah, please.
Sir, vertigo, there is a problem called vertigo, sir. So, with this biochemic medicines, can that be cured, sir?
See, for this vertigo, we have a remedy.
Oh, yes, sir. In Soham mixtures, the book means you gave one PDF before
No,
class. In that I
see whether
saw.
medicine is there or not. I just searching for a vertigo.
Oh, okay, okay, sir.
Vertigo.
Uh,
So chakkar and giddiness. See,
yes.
because this combination will work better than any other combination. Why? Because
Mm-hmm.
in homeopathy there are thousands of remedy,
Okay.
and the possibilities of cure is very less. Means we can assuming that we have 1,000 remedy. One chance is only one remedy out of 1,000 is going to cure that vertigo. But
Yes, sir.
here we have only 12 remedy.
Yeah,
One
yeah.
out of 12 remedies is going to have a effect on the giddiness. See, like that, this Darbari, we have for giddiness, vertigo, what it is called, you should know. For giddiness and this thing, vertigo, you already told the technical terms only. So, vertigo, the ferrum phos, kali, more, I was telling you, ferrum phos and calcarea phos are to be generally given in 12x potency. Here you see they are using it in 12x potency, and yes, it is there. So with this we can mix, we can give, and vertigo is for many reasons. But of course, in this book, what they are doing, they have covered all the reason.
Okay, sir.
Like NP and NS, what they are doing in our body. We'll come back because when
Yes,
we
sir.
see that what it is doing, with that we will come to know why they have added into this book. NP and NS, it is the acidity formula in biochemistry.
So in this, 7 medicines are added, sir.
Yes.
FP means
Ferrum
ferrum
phos,
phos, calimur,
calimur,
caliphos,
caliphos, calisulf,
calisulf, magphos,
magphos.
natrum phos, and natrum sulf.
Perfect.
Okay, sir.
These are the remedies, and these are very, very tested formulas.
Okay, sir.
These formulas you can pakka rely on,
Mm-hmm.
100%, because it is certified, you can say.
Yes,
So
sir.
your first attempt should be this remedies. Either make by the numbers, or you can say use the cards. Believe in the cards and the dials. Don't try to purchase and make them. Don't deviate from your drugless concept. You can
Yes,
do
sir.
it, but it is not ethical. It is unethical.
Mm-hmm.
Since whatever you are, you are trained, please use that. So use the different cards for making these remedies.
Yes,
Okay,
sir.
that's all you can say. Definitely, there are so many things we can do in this. There is a one I frequently use one formula in this, that is fever formula. Of course, uh, before the Vibronics, I was using with all my tissue salt only. I used to get out in the powder form and mix and give. After when I got the Vibronic with that, I'm just making with the machine. So my favorite formula is that for fever. Fever, very beautiful
Thank you, sir.
formula. Anyway, I remember that. What is the ferrum phos, natrum sulf, and the kalimur. These are the formula for fever. Let us see, we'll get that fever because we are already going in the C chapter. Yes, fevers. Fever, malaria, fever stimulant. Oh, it is only a meaning. What is the meaning of fever? So let's go to the fever. It was not there in the earlier book. This section was not there because since they have, this is for the lay practitioner. They wanted to give the information so that you become a master, because you should know what is a fever and what is a hay fever. Hay fever is a sneezing and cold, and frequent sneezing is called as a hay fever. So that also you should know. Hay fever, if someone comes and tells you you have a hay fever, you should not start a remedy for fever. Okay, like that. So knowledge, see, nothing evolved, everything at one thing. So anyway, it will come into this one. That's a fantastic formula. China prevention of this one, because they have added homeopathic also. That's a good thing that you can add it also along with the biochemic with the cards or a dial. And biochemic I have also added in the Paramanada Brahma users. They can make these combinations very easily now, along with the acupuncture points. But that Sri Ramji advised me to make all the Soham mixtures and Soham combinations also. We'll definitely do that also. So let us make our job easy. Yes, you see, I told you, because I remember this is a fantastic mixture. Sri Ramji, I am telling you, mixture, fever mixture, ferrum phos, kalimur and natrum sulf, every 3 hour or 4 hour, pakka reduce kiya hai.
Yes, sir.
Especially for children, 100% result hai. Don't try anything else, because those all are, even I'm telling you, even it is better than our JFM mixture number 18 se bhi badhiya hai.
Okay.
Because it does because all I told there are only 12 remedies which will do all miracle.
Sir, one question, sir.
Huh?
When we obtain this mixture, we have to follow the same potency, sir, for each content.
When you are making the mixture separately, or when you are making with your dial machine, that time you use this.
Okay.
Otherwise, when you are making the mixture by Paramnath Brahma, you set it to 12x.
Okay, okay, okay.
12x highest potency you can set.
Okay,
So
sir.
let that in Kali Moore and Kali Netam self also, let it come in a 12x potency.
Yes, sir. Yes, sir.
So now let us see that where is the materia medica. I'm searching. We'll see that where is the materia medica of biochemistry. So that's very interesting. We should know each remedy what you should do, because whatever I am remembering I can tell you that, but you should be able to refer it after the class also. We'll see in the there are lot many case histories given in the book. Lot many what miracle it is, and there is a one more uh, combinations they are prescribing here, that is CPKPNM. That is called as a heart attack preventive. Materia medica of some important medicine, therapeutic and respiratory. Biochemic who discovered miracle materia medica of the 159. Materia medica of the important, and there the importance there is 150, page number 159. Yes. Where that page number is in the therapeutics. Very important note, as I already told you. If the patient is worse at night, CP3x or 12x and SX may be added in the separate formula. Please go through all these things, because आपको इम्पोर्टेंस ये होना चाहिए, इसको ये इसी से ठीक होगा, इसी का what is it, what is the abscess क्या है, वो सब it is written in the initially it is written. Yes, मिल गया. Page number, I don't know, it is not, it is reflecting here. Page number, otherwise I would have come directly here. So, yes. Materia medica of important indication of the use of the 12 tissue salt.
Sir, page number 162, sir, I think.
162, yes. We
It is
can.
showing on the top, sir. 162 of
But
280.
it's some
Yeah.
introduction and all, no, they will.
Oh, okay, okay.
Yes, that, thank you. I would have
Ah,
searched here only after that number. Thank you. Good.
yes, sir, yes.
It's okay. So, Calcarea floor is a wonderful remedy. Wonderful remedy. Wonderful remedy. Who doesn't want to look young always? अगर कोई इसमें है, they want to look older, except me. है ना? तो if you have a older look, people will think that he has got a lot of experience. है ना? But who doesn't want to look young? Everybody want to look young, and we spend little bit of time on the either nowadays in the mobile selfie, we can see here and see how we are looking, and also on in front of the mirror. Okay, why I am telling you this? Because calcarea floor is the first remedy which avoids the sagging of our skin. Anywhere sagging, it will make your skin tight. So that is the first thing. One looks old because of this skin sagging. Okay, let us see here what they are telling. Useful for the adenoids, swelling of the gland, enlarged varicose veins, malnutrition of the bone, bones increase due to the injury, dilation of the heart, blood vessel, pile, skin, tongue, and cracks, stony hardness of the gland, hard cancer is cured with this. This is an excellent for easy childbirth. Anywhere this particular salt is where elasticity is there, fiber. Anywhere elasticity is there, this particular thing is used for that only. It is used for easy childbirth and also for the sagging of the skin. Even for sagging of the breast also, it is a very wonderful remedy, so that it will avoid those things. Because we are studying this, so even though we have everything with us, we neglect it. I request many of our mothers and sisters and other people to use it as a calcarea floor. You should use it on daily basis, because that is the thing which makes our it regenerates us. Okay, so, and even it is used for breast glands swelling, and breast tumors also can be used. Anywhere you can see that glandular swelling, or you can say lymph node enlargements here and there. And along with that, you need to add another remedies also. Those all already there in the therapeutic region. What all mix can give, for example, for any glandular glands, or you can say either in the breast or on the lymphatic glands or in the stomach, you can use calcarea floor, salicia, and kalimur, and many things. So like that, let us read one by one. Then we'll come to know. Next is calcarea force. CP is calcareous. Calcareous, it had wonderful property in restoring health after acute disease. It is very useful for anemia and ricket. It cures gallstones and prevents their reformation. It is using during dentation and should not be given now and then. It should not be given now and then. It should be it is useful during the dentation, and it should not be given now and then. Means it should be given on regular basis. एक दिन दिया ठीक हो गया, ऐसा नहीं है. So mixture of calcarea phos netramure is excellent for heart failure. I was just telling about that. CP, KP, NM. CP, KP, NM is an excellent remedy for heart attack, heart failure, and during that time, this should be, they say everyone should carry it in their pocket. Okay, this is actually they are talking about this made up of sugar pills, because we can't keep water in our pocket, and definitely since it is in 3x potency, definitely it doesn't have any raw ingredient in that. Now calcarea sulf.
Sir, sorry, sir. One question here, sir. So based on your experience, what is the recommended dosage, sir? CP? I mean, how long it should be used? And
3 times a day. We have
okay.
been giving all these combination 3 times a day, made with water or pills. If pills, we are giving 4 pills 3 times a day. If we are giving drops, we are giving 8 drops 3 times a day. And this will be made by the either card or the direct dial.
Okay, sir. And how long, sir?
Till the time they recover. Means fever, if initial fever is there, within 2-3 hours, it clears the problem. If slightly it starts getting the fever, someone thoda feverish jaisa lag raha hai. If somebody says that you can start within 4 to 5 hours, it will clear.
Okay, because this there it says gallstones. Gallstones might take 6 months, 1 year, 2 years
Correct.
also to get
Correct.
cured.
Yes,
So
yes,
until
right.
then they should take, sir?
They have to,
Until
they can
then,
take it for long period also. Gallstone, because gallstone, how it is formed, gallstone kaisa form hote? That is a bile juice in the gallbladder. There it becomes a crystalline ho jata hai. The stone is not by the anywhere what we eat, that stone will not go and sit in the gallbladder. It is the own acid, that is the own self formation. Now nobody puts the stone from outside. It is that juice converts into a stone. To cure that, to remove that, it needs a lot of time, because it first has to correct metabolism. Why it is forming, that it has to remove. That cause it has to remove. For that it takes time, definitely. But
so anything else, sir, along with this CP? Any other, I mean, which you recommend, sir, along with CP combination?
sir, there is a combination in this only. We will search for that.
Okay. Fine, sir. Fine, sir. You can, yeah.
Uh, yes.
Okay, it's here. Okay.
Gallstone. Gallstone, a small hard substance formed by deposit in the gallbladder. Certain element like bile. I was telling, no? How the gallstone is made? Made with a bile. Give 1 drop of cantharisis 3. No, they have given, for that only their reason, they have given the homeopathic materia medica also at the beginning. So you can add, along with the gallbladder, you can add a cantharisis 3 also from the following numerical materia medica, and little water every morning, 3 to 4 days. The stop formation of the stone. If fails, that time calculate for you all this to be, you see, all this combination will be very useful. And this formula you can pakka trust. You can have 100% trust. You don't trust on me, but you can trust this book 100%. It gives very good result. And you can see the testimonials in this book. You wonder. I'm telling you. This is my one of the most favorite book. Okay. So
Okay.
what is the gallstones combination? This mix, this, and you are telling now what else we can do. And to dissolve stones, to remove stones, they are already given here. Okay. Gallstones
Thank you.
takes time. Otherwise, even our kidney stones, they come out very easily. And you see, to prevent a reformation, calcarea phos 3x 4 times a day. Already beautifully they have given, and how to manage this excellently they have given. Okay. So like that you can. Okay.
Thank you.
So calcarea phos is used for gallstone also. Next, calcarea sulf. Calcarea sulf, you can, just for your information, all sulf will work on the skin. All sulf, like calcarea sulf, kali sulf, like that, all will work, and sulfur, they all work especially very good on the skin remedies. Okay. So next is, when select remedy act for short time, it helps in the enhancing their action. It heals the abscesses after the silicia has been given. So when it is used for abscesses also, abscesses मतलब कहीं पस आ गया तो उधर भी काम आएगा. Ferrum phos is it is very useful during the beginning stage of the inflammation and fever. That's why we are using our fever formula: Ferrum phos 12x, natrum sulf 3x, and kalimur 3x. If we add these three and give, wonderful. It take case of fever. It's very useful. And आपको कोई challenge करता है क्या ठीक कर सकते हो? Like paracetamol, can you make a patient, you can say, you can reduce the fever and all? I have done it. I have done with the same formula. You can also definitely try. Okay. And when there is a pain, Ferrum-Phos 200x and Kali-Phos 200x removes the pain of cancer. They have, there is a pain formula in this book. In this book is Ferrum-Phos 200x, Kali-Phos 200x, Mag-Phos 3x, Magnesia Phosphorica 3x. You can just go through that combination, you will find that. Okay. So I am sure that it is made up of this remedy, because I used it like anything, My pain powder is very famous. Many people, quite before this Vibronics, I used to make a pain powder bottle. I think still it might be here and there. I don't remember. Okay. So Kalimur. Kalimur is for what? It works on the gland and tonsils and, any stomach problem and mucous membrane, and taking rich food. If any patient is worst after rich food, what is rich food? Taking ghee, or you can say oilish things, and that is called as a rich food. And even high protein can be food, you can say, not a protein drink. This is very useful in that time. And Kalimur especially works on the gland. I will tell you, you must write it down. Definitely write it down. Only one thing you should know about everything is calcarea floor works on a gland and elasticity. Calcarea phos, works on vitality. Vitality means it is just like a general tonic. Calcarea sulf works on skin. Ferrum-Phos works on the iron in the system, anemia or fever. Kalimur works on the glandular system, tonsils, fever, and stomach. And next is Kali-Phos. Kali-Phos is for, it beautifully works for the blood poisoning, and when in a diabetic wound, we put this powder also. In diabetic wound, we put this powder for a dressing. So it takes out all the dead material. It makes that flesh very fresh. Okay. Calcarea phos is for that thing. And calcarea sulf, I told you, all sulfs are for a skin disease. And that much only you can remember. And even calcarea sulf is also believed between the chronic of pulsatilla. A pulsatilla, you will come across the homeopathic remedies. I think it is available in this also. I already told you how you have to study the homeopathic materia medica. You study the first chapter only. Remember every remedy's first chapter. Or whatever, how I used to do, every remedy, remembering the first chapter is very difficult. So how I used to do, whatever today I am coming across the remedy, I'll study that first chapter, first paragraph, and understand it well. So like that. And magnesia phos, excellent for pain. I was telling you, in the pain remedy, it is used in 3x potency. Natrum mure, what is natrum mure? Common salt, sodium chloride. So it is very good. It is also for so many purposes. You see, if sodium chloride is a deficiency, one go again anemia. It creates anemic things. It creates a weakness, sudden collapse, sunstroke, heat stroke. Body में electrolytes are not in correct proportion. What happens? Dehydration. Like that. Natrum phos, useful for a tuberculosis. Jaundice. I already told you. The natrum phos and natrum sulf, they are very good pair for controlling the acidity of our body. Very useful. And mental trouble caused by the injuries and that is one more thing. See, there is a book called Clerk Material. I have read many books. So I will be connecting all those things. There is a Clerk Materia Medica. In Clerk Materia Medica, there is a Clerk Repertory also. Dictionary of Materia Medica. In that, there is a causation repertory. Causation repertory. Causation means किससे हुआ तो क्या medicine देना. If injury to head, in that one they have given the natrum sulph, and it has done a miracle. No, when the one with the Dr. Suvarna gave for one head injury person, the doctor was not available till the time he recovers. He comes back for like that. It is given within 2 days. All his broken things, all hematoma or blood excessive bleeding was gone. That doctor was surprised. That main remedy was natrum sulph. Natrum sulph was the remedy for head injury. Remember, you have to ask, I may be asking you, many time you people are consulting me, like, iske liye kya medicine dena? Then bola, what was the injury? Have they undergone any accident? If accident, where was the injury? If someone has got a head injury, after that he is gone on coma, or you can say not able to paralyze, or anything like that. So in such cases, any injury, any old injury, you can give the natrum sulph. Natrum sulph also called as it is antipsychotic also. So when we are talking about the miasm, I will tell you about more about this. Natrum sulph is an antipsychotic remedy, and all problems are more in the damp weather. And the good remedy for, I told you, acidity and diabetes. So worst from lying down left side, these are all the main where it is used. And chronic defect of, I was telling you, psychotic remedy means the gonorrheal effect. So psoriasis, syphilis, psychosis, and the tuberculosis. These are 4 major miasms, and Shankaran has taken into 10 miasm. We will discuss when we are talking about those things. Okay. Then that's why, because our joint pains, arthritis, it is believed to be the cause of gonorrheal infection in our past. Past in the sense, 8th generation. We don't know what we know about ourselves. 8th generation, if someone had attacked the gonorrheal infection, that will come in the different form. Mutation, just like a mutation, how virus mutate. In the similar way, that poison will come in a different form. So one of the prominent form is joint pain. Knee joint pain is one of the prominent form of gonorrheal infection. For that, what we give? Natrum sulph is a wonderful remedy. All rheumatism. Along with that, there are so many other remedies like magphos for pain. And if it is a calcarea floor, if fibrous tissues are involved, I told you fibrous tissues are involved, you can think about calcarea floor. Like that, you have to cover the remedy. Okay, and there we have a remedy called mixture number 12. Mixture number 12 is a combination of all the 12 tissue salt. Many places it is used. See, if someone is is it a good idea to give all combined thing to a person instead of giving each individual? Can anyone tell about this? Can we give all the remedy mixed instead of giving each required individual? Natrum sulph only is there, okay, only give the natrum sulph. Or if natrum sulph is required, we are giving all the 12 tissue salt. Is it a good idea? Tell me, no problem. Mistakes or you can say whatever, no mistake here. Whatever you say, it is correct.
Sir, can I try?
Yes, sir.
Dhananjay.
Yes.
Sir, I think giving everything, body will take what it needs is what I think. So I may be wrong here, but yeah, that's what I think.
That's correct. That's one side thinking is pakka 100% correct. But when you imagine this 12 tissue salt as a 12 color, if one particular required person required a red color, and instead of giving red color, or you can say applying red color on that particular point, if you apply all the color, what color it will become?
Correct. Yeah.
So like that, it is you are very correct. Body is craving for some salt, and it will take that salt. That is a good answer. I agree to that. But I have seen that if McPhos is required, because it is all balancing the body, just like, five element theory. The five element theory, what is a wood, fire, and
Earth, water, and ether.
earth, earth, and after that the dryness. What is the dryness and kidney and liver, like that, these are five element is there. When you require a spleen element, you can say yellow color is required at that particular place. If you apply all the color, what will be the thing? Means there is an imbalance there. If there is an imbalance, you have to use the imbalance technique to balance it.
Yes, sir.
That's my idea. So no problem. Whatever you say, that's correct. And that's why Swami Narayani thought like you only. Swami Narayani thought like you only. Oh, no problem. Let me mix all the 12 tissue salt. Whatever is required for the body, let it absorb and become all right. Okay? Fantastic. Good. So now Salicia is very, very important remedy. Salicia is very important remedy. And Salicia, whatever the symptom of Salicia is worst at night. Any symptoms are going worse at night, Salicia to be used. And Salicia is the only one remedy which action of the remedy depends upon the potency. If in case, if any pus formation, if someone, boil is there, boil आपको पता है ना, a small boil filled with a pus. If you want that वो जल्दी पक जाना है, ripe, you should ripe, and that pus should go out, and you should become painless. If you think this way, that time you should use Salicia in low potency, 3x potency. If you use Salicia in 3x potency, it makes the pus formation fast, and it ruptures and relieves you pain. At the same time, there is a caution. If there is any, there are likely to that abscesses are there in the chest. If you give that, there is maybe, it is a rupturing from the lungs. Anyway, this applies to the original form of the biochemic only. Here we put along with the biochemic, the Silicia 3x, we put our thought, and we infuse with the thought. It's very safe and works as it is directed. Okay, so that's it. And the open air during full moon and new moon, if anything, full moon and new moon, and किसी को होता है कि कहीं भूत प्रेत का कोई ऐसा है, छाया है, and he becomes restless in the full moon and the new moon, कुछ नहीं कर सकता. In such situation, you can think about Salicia. Think about Salicia. And अगर I'm telling you, अभी बोलने के टाइम में और भी एक याद आया, if anybody is भूत प्रेत दिखाई दे रहा है, तो कौन सा मेडिसिन देना? होम्योपैथी के अंदर एनाकार्डियम. When in anacardium, yes, you see here, already is there. So let us see. एनाकार्डियम में LMNO. How I came to know about it? I will teach you the technology how to know about it, because I was reading, I read this, that with that, I don't know whether this Materia Medica has about it or not. Yes, देखो. I'll make it some more bigger so that you can also, if possible, you'll be able to read. I was telling you, if हमेशा आजकल क्या है ना कि we are thinking about the black magic and having a possessing the bad, what do you call, evil powers, evil, what do you call, evil spirit. But it is not like that. Always a doctor, or I can say healer, should think that what can we correct in this person so that he becomes a normal. So here, mind, just see about the mind. Fixed idea. Hallucinations means that's what. Oh, उधर वो आ गया, देखो क्या कर रहा है, वो बैठा हुआ है, मेरे को बुला रहा है. Then you will become very very पक्का वो मांत्रिक तांत्रिक, वो सबको इधर मौली वो इसको बुला देगा. वो आएगा, वो अब आप अपना पैसा बना के लेके जाएगा एंड आपको बोलेगा हाँ माँ, हाँ जी सब चला गया, आपको बिल्कुल ठीक हो गया, मेरे भगा दिया, देखो उधर भाग रहा है, बोलेगा. आपको पक्का ये कर देगा. हाँ, आप देखो उधर भाग रहा है, मेरे को तो क्लियरली दिखाई दे रहा है, आपको दिखाई नहीं दे रहा है, बोलेगा. ओ उसको इतना बोल रहा था, बोलेंगे हाँ हाँ बोलेंगे अभी आप भाग के जा रहा है, मैं देख रहा हूं, ऐसा आप बोलेंगे. बस यही कहानी है. सो हियर, सो एनीबडी इज हैविंग अर्नड, ये पक्का कोई भी ड्यूअल साउंड में काम करता है. आपको बोला वो कैसा, कई आर्ग्यू करने वाले बहुत होते, वो कैसा. एक बार वो जो भूत आ जाएगा तो वो मेल वॉइस में बात करता है, वो फीमेल है, तो ये कैसा हो सकता है. बोलते इस रेमेडी में है वो. यू सी, ही इज पोसेस्ड 2% और विल, उसके अंदर दो आदमी है ऐसा सोचता है. सो ऐसा है तो एनाकार्डियम यू हैव टू गिव. एनाकार्डियम, what is that? There are two anacardium. Anacardium oriental है. When you give anacardium oriental है, कोई भी किसी का भूत प्रेत है ना, उसको छुड़ाने का एक ही, दिस वेरी गुड मंत्र. वन एनाकार्डियम से चला दो, एनाकार्डियम परम ब्रह्म चला दो, या एनाकार्डियम बना के दो. So or you can say एनाकार्डियम का मैं दो के ना. There are so many technique you can do. एनाकार्डियम का जो अगरबत्ती है ना, अगरबत्ती एनाकार्डियम का पानी के अंदर डुबा के दे दो, लेट देम बर्न द एनाकार्डियम देर. अगर जब होता है तो देन यू सी डेफिनेटली इफ इट इज, ये होता है या नहीं होता है ये ना. पहले हम हीलर लोग या डॉक्टर लोग पहले ये नहीं सोचना चाहिए कि उसको भूत प्रेत लग गया. नो, यू ट्राई फ्रॉम यूर लेवल. आपको भूत प्रेत लगाने से आपके पास क्या है, एंड यू सी दिस इज अ टेंडेंसी टू यूज द वायलेंट लैंग्वेज. ये पक्का पागलपन के लिए अनाकार्डियम यूज होता है, एब्सेंट माइंडेडनेस के लिए होता है, वेरी इजीली ऑफेंडेड. मतलब भूत प्रेत लगाने के टाइम में क्या होता है, सडनली गुस्सा करता है, फेंकते हैं, सीम्स बेंट ऑन विकेडनेस, हाँ, एंड लैक ऑफ कॉन्फिडेंस इन हिमसेल्फ एंड सस्पिशियस, एंड क्लेयरऑडियंस. क्लेयरऑडियंस मीन्स बगल के घर में मेरे बारे में बात कर रहा है, ऐसा सोचेगा. सो दैट इज व्हाई आई एम गिवन यू वन एग्जांपल दैट. सो यू शुड थिंक इन दैट वे. इफ फुल मून एंड न्यू मून में अगर किसी को प्रॉब्लम आ रहा है, पहले गिव सैलिशिया 12x, सैलिशिया टू बी गिवन इन 12x. सो after that you can observe 1 month, or you can say how they are feeling. अगर अच्छा लगा then God he will come, sir what अपने, and आपको उनको ये नहीं बोलना है कि उनको भूत नहीं लगा है, वो नहीं लगा है. don't tell the story. ठीक है, we have a remedy for that, don't worry, it will become all right. You see, because उनका घर से आपको भूत को भगा सकते हैं, लेकिन उनका मन से नहीं भगा सकते आप। उनका मन इतना भूत को पकड़ लेता है, वो नहीं भगा सकते। तो इसीलिए सो यू से हाँ वो चला जाएगा, एंड यू ऑब्जर्व ओके, हियर्स द वॉइस फार अवे ऑफ द और ऑफ द डेड, है ना, यही है। कोई मरा हुआ बंदे का उसका आवाज सुनाई देने लगेगा, इसका मेरे घर जो दादी है, माँ नानी है, मर गई थी, वो मुझे बुला रहा है, वो मुझे बुला रही है। This you will feel, means why I am telling you, give an example that ये सब भूत प्रेत में होता है, इफेक्टेड में होता है, बट दैट इज उसके लिए रेमेडी है। सो पढ़ना चाहिए। दिस इज ऑलरेडी आई शेयर्ड लास्ट टाइम, बोरिक मेटेरियमिडी का। दिस वन आपको जो भी है इसका फर्स्ट पैराग्राफ पढ़ना है। ओनली दिस फर्स्ट पैराग्राफ पढ़ेंगे तो आपको इसके बारे में आपको पता चलेगा कि हाँ, ओके ना। सो दैट्स इट। अभी विल स्ट्रेच्ड टू लॉन्ग, है ना, टू लॉन्ग नहीं, कितना 1.5 hours हो गया ना, 11 वी स्टार्टेड। गुड। सो वी विल सी सम मोर थिंग। If we got a symptom, then how to tackle? We have got a symptom. That is the third book. We everything we studied with the disease and the symptoms we have seen. We got a particular symptom. This is a biochemic repertory. It is called as a biochemic repertory. Okay. So we again will see, try to see. We will see eyes. Dhananjay ji, that is a phytostigmata. The floaters in the front of the eyes was a phytostigmata. It is there in the book. We saw that, and that time our Sri Ram ji told that he told correctly.
Okay, okay, sir. Thank you.
Sir. And vision is a very good remedy in our this one for giving and how we have to refer the repertory. If you have to see the bold one, or you can say you see that on the border what is right, they have written in the border cold and company. In this page these two topics are covered, cold and the company. Okay. Extracting eruption, different type of eruption, yellow eruption and white eruption, so many, you know. For that we have a different biochemic medicine. For example, we go to the eye section. Agar aa gaya eye. Let us see from where it is started. Yes, eye इधर से start हो गया. Eyelid. Agglutinated, means they stick together. सुबह सुबह के टाइम में थोड़ा कचड़ा भी आता है वो. That is the thing. Eyelids, eyebrow, eyelids, and हाँ ಮೇಲೆ ಹೋಗಿ हाँ ಮೇಲೆ ಹೋಗಿ ತೋರಿಸ್ಬೇಕಾಗಿತ್ತಲ್ಲ.
ಇಲ್ಲ ಆಯಿಂಟ್ಮೆಂಟ್ ತಗೊಬೇಕಾಗಿತ್ತು. ಕ್ಯಾಲೆಂಡುಲಾ
ಫಸ್ಟ್ ಫ್ಲೋರ್ ಹೋಗಿ ಮೇಡಮ್ ಇದೆ. Okay, so eyelids, bleeding, burning, close, cyst. This is are all on the eyelid only. This is Mataji, we talked about Chalajan. That Chalajan, it is what to give the Chalajan, kya dena chahiye. So that is the tumor on the lower eyelid of the lower edge of the eye. So we can say if chalajan is there or not. You can give cyst on the lid. We can give ferrum phos and salicia.
He's already been healed, Sarji, by the chalazon only.
Fantastic. Good, good, man. Nice. Good. आपने क्या क्या दिया था मैडम?
उसका जो बनाया था ना नादा, I
हाँ,
have the
नादा
text.
बनाया।
If you want, yeah, I can
या
share it with you.
C5 आपने दिया था, याद है, correct.
Yes, yes.
Right. Fantastic. Now, so it is all talking about eyelid. Heaviness of eyelid. This is eyelid and the heaviness. How we should read the repertory. Eyelid heaviness is by total, all the remedies are there. These are total 4 remedies. अगर कोई भी आपके पास आकर के बोलता है कि मेरा eyelid heaviness है, तो you can give all the 4 medicines mix करके पक्का दे सकते, no problem. Because they are all some portion, some part. If natrum mur, you see, natrum mur and natrum sulf, they are, and salicia, they are written in the bold letter. Bold letter means that is the probability of the healing is very high. So you can give natrum mur, natrum sulf, salicia, बेचारा natrum phos क्या कलेक्ट करेगा, वो भी ऐड कर सकते, like that. So left heaviness of the left eyelid. If someone comes and tells you, I have the heaviness of the left eyelid, that time instead of giving all those 4 mat dijiye, because we are very precise. As precise you are, that much is the possibilities of probabilities of cure is that much. Okay. And so left eyelid heaviness is there, Califos is a remedy. Lying down aggravation means heaviness of someone will come and tell you. What they will tell you, I feel my eyes are very heavy when I lie down. That time only it becomes very heavy. That means you should think about natrum mur. And someone says my eyelids become very heavy and keep closing automatically at the night time only. That time you should think about the ferrum phos. And there is the eyelid inflammation. You can see small, that pus formation, some eruptions and the eyelid. You can think about all these 4 remedies, because eyelid is consist of again eye and a lid made up of skin, and it works on the skin like that. Calcarea sulf, Cali sulf, natrum mur and salicia. And a margin. And generally it is like that only. Margin of the eyelid inflammation is there, natrum mur. Like that you can go precise. This is what I'm telling you. You can go and make the mixtures and give, but that is a probability, that is a 75% possibilities that you are able to succeed. If not, then what you have to do, don't blame the radionic machine itself, or you can say, "Arey bekar ye kaam nahi karega." No, think what I have not added into this. Why ठीक क्यों नहीं हुआ? हम लोग directly we come into the conclusion that yes, हम बोल सकते हैं हम मूर्ख है इसलिए हम उसको ठीक नहीं कर पाया. नो, यू सी व्हाट आई हैव नॉट अटेंडेड, हमने क्या देखा नहीं, है ना, वैसे देखना. सो इन्वर्शन ऑफ द आईलिड, कभी कभी क्या होता है, आईलिड इन्वर्ट हो जाता है, वो करके प्रॉपर ये करता है. एंड ईचिंग ऑफ द आईलिड इज अ कॉमन प्रॉब्लम. सो मार्जिन itching, that these are the remedies. So beautiful it is. We have selected a very good topic of eye. Okay, so now paralysis of the eye means it is not under your control. Either it will be kept open or it will be kept closed. Redness of the eye. Now you are coming to the next thing, like redness and spasm styes. No, it is called as a stye. On the lid, we get a tumor, and it becomes a, there is a pus formation into that. So that is the eyelid swollen, eye swollen, like that. We can think about tumor, cystic tumor, sebaceous tumor, and nodules. So like this, about eye, it is only about eye. So such a depth it is. I have already shared this book. Ulceration of the mani. And next is eye. Eyelid khatam ho gaya. Now we are talking about the eye. So eyes ke liye the best remedy is, general remedy, best remedy is netramure, common salt. Okay. Alteration between the backward, drawing backward, boils over it, burning, cancer of the eye, fungus in the eye, closing, crossed, you see, crossed as if, मतलब तिरछा नजर, what do you call squint eye, उसके लिए भी होगा इसमें, देखेंगे. Dryness in the eye is a common, very difficult problem. In the Darbari, you may not get the eye dryness. There we may get eye itching and other thing. Here, for that, this particular book is very important, that we can go into the minuteness of that particular problem. Eruptions on the eyes. Now next. Forced foreign heaviness, inflammation, injected, itching, lacrimation. Lacrimation is a drooping of eye tears, looking down aggravation, looking up aggravation, motion. Okay, next see eyes. This is same. When you see on the top, if it is still eye, everything is talking about the eye only. Eye drawing backward. ऐसा लगेगा कि eyes पीछे खींच गया है ना. When it happens, sunken eye they call. So in that time also you can think about this. And eye closing aggravation, eye at work, eye body, foreign body is as from. Yes, Dhananjay, we can think about this also, and we see we have a separate symptom for that also. As
Okay,
if there's
sir.
a foreign body in the eye is a different thing. No, they feel अगर आंखों में कुछ गया करके वो उसको they keep on rubbing. So that is the thing. I think so. This written here, we have to think match most. Okay, so stitching, shooting, sudden sunlight touching, ulceration, warmth, yes, PQ, paralysis of the muscles of the eye, photophobia, perspective power lost, protrusion, pulsation, redness, reflexes, sand as if in the eye. Means why I am showing you that we have to go such a depth. Swimming in the eye, like tension decreased, tension in the eyes. And the Dhananjay ji, these floaters will have during the glaucoma also. That I have
Yes.
gone through. Well,
Yes, sir.
there is a glaucoma, and if they are diabetic, you can suspect the glaucoma also. So glaucoma,
Yeah.
you can refer this netramure and salicia. Like that, we have to think why it is happening.
So yes, sir. Just to tell you the background, the person had a CKD issue and edema, and he was diabetic. So this was one more complication which got added. So
Good. So like that only you have to tally. And there is one more thing in here. So tension glaucoma, we selected the netramure and the silicea. Okay. And another thing, if redness is also there, then what we have to, what are the common remedies between the glaucoma, tension and the redness in the eye? We have to take the common remedies like netramure is there in the glaucoma. Is it there here? It is there with a bold letter. And silicea is there. Yes, silicea is there. So that time you don't need to give all this for the redness. For redness, you give netramure and silicea, and that will take care of the redness of eye and as well as in the glaucoma. So actually, the reprioritization is like that only. Two different symptoms, check what are the common remedies. More the symptom, more the common remedies. Like, only one remedy may be covering all those different symptoms. That time you are very sure that if you are giving, after giving this, it will cover his more symptom. And how the symptoms are, how it is done? Someone has given the homeopathic remedies, or you can say like a netramure. If a netramure was given in a poisonous form, no, either earlier they used to prove like that, but nowadays they are all proving is done in 30 potency. 30C potency, it is given, netramure given to the person repeatedly without problem. Without any problem, he is given morning, night, afternoon, like that, continuously for many days till he develops these symptoms. And those symptoms are listed and put according to the head to toes, and that is called as a materia medica. And what is happening in the head, that is written in the head column, that is called as a reparatory. What it made the problem with is the netramure after consuming what it made with the passing stool, it made him the constipated. So you can say that a netramure medicine for a constipation also, provided if he has other symptoms also. Okay, so in this one, these are a lot of job you have to do, because you have to go in depth of this book and take one symptom, take one person. When someone is talking, what you do, yes, I was talking about the gangrene. You see gangrene, they have used the Califos also. I told you now, when it makes a dead tissue, it recovers the dead tissue. It removes the poison from our body. So that is a Califos, they are using it. So gangrene, cold gangrene, silicea, mustard application from the if something mustard, though the hot mustard, if it is falling, or you can say they are using it, if it is coming, that is a remedy. So there is everything like that. Like in a gastritis, you will take another gastritis. General gastritis is a stomach pain with the acidic things also, acidity. So that time Ferramphos is for Ferramphos and Calisulf will do. If after taking alcohol, or if person like that, if somebody is having a chronic, that like that, Celicia, enteritis, intestine. So intestine, the infection due to the intestine, what is typhoid? Typhoid is the intestinal disease. Intestines becomes the inflamed, and because of that, it creates by the typhus bacteria. It attacks to your intestine. From there, if any fever along with the stomach pain, you should think that this is the typhoid fever. But in the beginning, if you are giving our biochemic this fever formula, or our GFM 18 fever, it will immediately stop and it will not go into the next level. So this is all I can say. Anything now, I would like questions from you, so that if anything I left I will cover up in your questions. Any questions, please? Yes, sir. Any questions, please? Anything want to know or anything I forgot to tell, or if you already know, you share with that so that it will be a good information to whole team.
Sir, I have a question about spine. So I know this case where the person has the spine is bent. It is said it could be a case of ankylosing spondylitis, and it's bent slightly. So at this stage, can we use this tissue salts?
Yes, something is very surgical. There is in any disease, there are broadly classified into two categories. One is surgical, another is non-surgical. Means they all can be, remedies can make them all right. First, we have to think if ankylosing spondylitis is generally at the neck area, what happens, that the vertebrae, they join together and they become the ankylosing is that same thing. They become one particular bone instead of two different bone. The pad of the disc, they separate and they directly attach to the bone, and it becomes the what you call single bone. But we have a very good remedy. See, what you have to do is, if someone is coming with a bone problem and spondylitis, what you have to use? Whether you have to use the electrohomeopathy or biochemistry or our Narayani mixtures. That is very, very important decision. Or all that is also fine. All you want to adapt, like I was telling you, make a 3 bottles. One is biochemistry, one the Narayani mixtures, another is like that you can make and give. In such cases, if there is definitely our OEM mixtures are going, doing very good help. And one more thing, the Narayani mixtures are so specialized thing. जहां पे हड्डी बड़ा हुआ है वहीं पे वो डिसॉल्व करेगा, बिकॉज
or Narayani medicine, sir?
Yeah, Narayani, that bone eye, that is a third mixture.
Right, sir.
It has in the literature they have mentioned all sort of bone irregularity, maybe a necrosis or the enlargement. Even that's a very good thing. First thing you should give is how to cover up a disease. But fantastic thing. Bone eye 200 and bone eye CM. OM bone eye also to be given. Why OM bone eye? Bone is formed of what?
Calcium.
Thyroid gland and pituitary gland. What gland it is controlling the calcium metabolism. And you can also think about calcium mixture. Calcium, any mixture in this vibronic form can be given either excess or deficiency. This
Right.
bone eye, thus I was telling, always last time also I told you in rheumatic chapter, you only make a heel pain center. I'm telling you. Heel pain healing center. And you will see, because nowadays it is the specialization about people are caring. People are caring about the specialization. So you see, heel pain, only we are dealing with a heel pain, and that in that one OM RA 200 you can give or not. First bone eye 200, bone eye CM, if you give with the if it is a vertebral column, OM 4 you can give for the cervical, and otherwise OM 18, OM 31, OM 32, OM 33 if you give, pakka it will control over the spine. It will pakka, many cases people are very happy with medication.
Okay, sir. So, but if it's slightly bent, is it possible for it to come back to the right posture?
There are possibilities are there, but surely we can't say, because possibilities are there.
Okay.
Because no one has bent it to, किसी ने उसको बेंड नहीं किया, वो अपने आप ही हुआ है.
Right, sir.
अपने आप जो हुआ है वो अपने आप सीधा भी हो सकता है. और एक्सीडेंट से जो हुआ, जो जॉइन रॉन्गली, जो सर्जरी के ऊपर से जो हुआ, सर्जरी, रॉन्ग सर्जरी, देन वी कांट डू एनी हेल्प देयर. कुछ नहीं कह सकते हम, कहना भी नहीं चाहिए. ऑटोमेटिकली हुआ है, डेफिनेटली वी कैन गिव लॉट ऑफ रिलीफ दे सकते हैं. बट क्या होता है ना, व्हेन समटाइम सम एंकिलोसिस में क्या हो जाता है, our body and DNA programs in a such a way, it thinks it is my nature's position. This is only my natural position. It thinks and adjust to that environment. Ankylosing में ही उसको रहने का पसंद करता है. That time it is very difficult. But still, spiritual science can do many things.
Right, sir. Thank you.
Yes, ma'am. Yes, sir. Dhananjay ji.
Sir, no questions so far. But I think the floaters thing, I think I'll have to check it out. But yeah, I think I have got the solution, sir.
I have referred that. I referred the book for you, and after that I came to know that phytostigmata was one of the remedy.
Okay.
And that is what I remembered when I talked to Dhananjay. I will tell this. And the Sri Ramji is correct.
Yes. Yes, sir. I'll try that, sir, because I used the kidney failure combination. That itself gave him all the relief. In fact, his eye has also improved. So I just gave him a kidney failure combination and eye tonic.
Perfect.
From CC1. That's it. That's what I gave.
Eye tonic is a fantastic one, because many things are there in that. I think phytostigmata also might be there in that combination.
Yeah, maybe, sir. Yeah, but sir, it's helping, but just that it has to go completely. That is my goal.
Sure. And yes, sir, Kumar sir. And yes, thank you. Thank you so much for giving me sufficient time and my own time. Definitely we will think of doing it in the some middle of the week also, so that what happens, do you know, so you can get a sufficient time. Sunday आपको कहीं इधर उधर जाना है, घूमना है, you have sufficient time. Okay, so we will see, we will decide on what other day we can do, and one day on Sunday that will be there, and one in middle of the week we'll decide one day, so that we balance. We will not consume much of your time. You get a sufficient time for revision also. Okay. Thank you so much.
Thank you very much, sir.
Thank you, sir.
Thank you, sir.
Thank you, sir. Thank you. Sir, do we have another class today, sir, or is this all?
No, today we have another class today.
Oh, okay, 4 p.m., right?
Can we have it or not?
We'll have it, sir. I'm okay.
Yes, we will have it today. We are having it as on 4 o'clock today.
Okay.
Thank you, sir.
Thank you, sir.
Thank you, sir. Yeah.